Hello guys, the NCRT class 7th we had done chapter 1 and now we'll discuss chapter 2, which you can see the heading Role of Government in Health. Okay, this week two important health updates are there. One is the Prime Minister has told that all above 70 years, irrespective of any criteria, will be included under the Ayushman Bharat health scheme and 5 lakh rupee coverage will be done automatically. Okay, so this is one very important update for everyone living in our country and who is above 70 years. That is the senior citizens you can call. And another thing, the cancer drugs GST was 12%, that is reduced to 5%, which is again a very good news. And so two important health update happened. So I thought like we will teach you lectures, okay, which is there in your static part of your syllabus. So UPSC, we are already doing free lot of lectures of almost every textbook. I'll show you all the thumbnails now. So chapter 1 was done many months back and then we had discontinued it because of lack of response. So now we are going to continue this textbook of class 7, that is social and political life 2. Okay, political life 1 was the class 6th NCRT in which local government we discussed. Here more of state governments we will be discussing. Okay, so this chapter was done already. This chapter equality was already done, and now we will do the second chapter, role of government in health, and then back to back now I'm going to do daily. So next will be the how the state government works. Okay, so this is very important for your preparation, and in front of every NCRT, you know, whichever subject you take, fundamental duties, preamble, these kind of things will be printed. Make sure that you read it at least once. Okay, no need to read it every day, but at least once go through it, because UPSC asks very minute details on this, like whether fundamental duty covers environment, whether it covers education, whether it covers human rights, like that. They ask certain things. You should be clearly knowing which fundamental duty is added when, because if you see this last one, okay, this was added later. Okay, so that also here it is inserted by Constitution Amendment Act 2002, effect from 2010. Remaining all was there in the previous one. Okay, I think in the 42nd amendment, that also will be written here. So you have to know these basics. You have to know preamble, in which every year one question will come. It's 2 marks in your prelims, and you cannot lose that mark. Okay, because that is a sign of a good aspirant, that you know the preamble, fundamental duty, etc. By heart. Okay. Now, if you see class 6th, as I told, local government we are done, I think 1 year back or 2 year back, entire thing was done, and this is 9 chapters are there. Please, if you don't know where it is, either in the description the link will be there, or simply in YouTube type whichever chapter or book you want. Okay, type Vaishya AS followed by the book name, like Polity NCRT, History NCRT, Geography NCRT, whatever you type, the playlist will come up, and please watch it because questions are coming directly from NCRTs also. Okay, so one of the implications of equality in society is the absence of what? This was asked in 2017 prelims. Okay, so absence of what? It is absence of privileges, meaning equality means what? You will not give any special privilege to anyone. You will not treat somebody as like a great minister or great this thing and all. You will always consider everybody as equal. So it is the absence of privileges. Okay, these all are extra unwanted options they have given to confuse you. Same year 2017 in the mains, one question came: to ensure effective implementation of policies addressing water, sanitation and hygiene needs, the identification of beneficiary segments to be synchronized with the anticipated outcome. So you have to examine this in context of WASH scheme. WASH is the same thing, water, sanitation and hygiene. So this one was a question that year many students told it's a difficult question, but if you followed current affairs and schemes and all, you will know WASH scheme, and this was a very easy question. So here today we are discussing health. That is the reason I showed you this question. Okay, now an extra practice question based on the lecture which we will do. Our country has the money, knowledge and people with experience, but cannot make the necessary healthcare available to all. Okay, discuss. This was the current situation, and we are trying to improve from this. So this you have to discuss by showing the past and present, and that is what this entire chapter you will study. Okay, similarly, if you need sociology NCRT, history NCRT, I told you, simply go and type Vaishya AS NCRT on YouTube. It's completely free. Okay, there's no other YouTube channel who will do every textbook for free. Here if you see Spectrum, R. Sharma, Satish Chandra, Tamil Nadu textbook, Nitin Singhania, Fine Arts, NCRT 6 to 10, NCRT 12. Now world history, I'm doing it. Okay, it will start maybe next week. So like that, many textbooks we are going to do, and we have already done. These are all already done. Okay, if you see, our teachers have done it in both Hindi and English. Polity have done in 2 languages. Environment we have done in 2 languages, and then this geography class 11th NCRT we have done in 2 languages. Economics is there in fully in Hindi. Hindi means English. Okay. So like that, every textbook which you need for prelims or mains, we have almost done free of cost. Okay, and there are other paid things also that I will tell you when the slide progresses. Okay, and PYQ is from where again questions repeat. So 2016 to 2020 is already there free of cost. More years I am planning, and that will also come. Okay, so please try to watch all this. And if you have not yet joined our test series, because all these batches are closed, okay, over the last 1 year I have been launching batch after batch, and you have missed the 25 batch 1, batch 2, batch 3, batch 4 and 2026 batch 1. All these things you missed. So I am opening a new batch now, 2025 B5 batch 5 and 2026 B2. Okay, so this will have these many days to study. If you calculate from October 14th, if I start the batch, then the test series will begin, like you will have 17 days left in that month. So like that, 78 days this year and 144 days the next year. So 222 days you will get for 2025 preparation. 26, because there is a lot of time, you will get again 78 days here. You will get full 365 days of this year, and 2026 only you need to give prelims, extra again 137 days. So total 580 days you will get. So please join any of these batches. Our students are studying consistently. That is why they are like mostly confident that they will clear. Okay, so now role of government in health. This is what we are going to discuss, and in just 10 minutes, 15 minutes it will get over. Okay, because it's very small NCERT chapters of lower classes. So here they will focus, as I told, on state government. This chapter and the next chapter they will focus on state government, in which there is public health space, private health space, and the constitution. What does it tell? Constitution supports a view that the right to health is an aspect of our fundamental right itself, and its provisioning, even though it is mentioned in the constitution, it is kind of unequal now. So we have to try to make it equal. That is why this government is making that Ayushman scheme, Jan Aushadhi medicines for lower cost, and you saw cancer drugs and all GST being reduced. Like this, many things are there. All these in your exam you should write in the answer paper. Okay. So here in this collage also different types of people, their food, nutrition, everything is shown here. So in a democracy, people expect the government to work for their welfare. Okay, because that is called DPSP, which we have, Directive Principles of State Policy. We expect the government to work for the welfare of the people. Okay, so they should work on education, health, employment, housing, development of roads, electricity, everything. So here in this chapter, we'll focus mainly on the health aspect. Okay, so what is health? Health means our ability to remain free of illness and injuries. Okay, that is, you will not have disease. But is it only about disease? It's not only disease. You should have clean drinking water, the lifestyle, pollution-free environment. Okay, because these are not diseases. These are like the basic amenities. So this, if you don't have also, you will have health issues. Okay, it need not be a disease. It can be because of the lifestyle and the pollution and the unclean sanitation and drinking water and all. You may get problem. Okay, so if you don't get adequate food to eat, you will be like malnourished and all. Your conditions may be poor. So it's like that, slowly you will move towards illness. Okay, so all these things falls under the whole bracket of what we call as health. Okay, so in villages and all, you know, people used to struggle to go like long distance to get water, and then they don't have much facilities. Electricity is not there. They don't have anything which can improve their health. Even hospitals are not very good equipped. So like this, many things are there. So it isn't health. When we now, whatever I told, it's all physical things or disease kind of things. Okay, but there's another thing which will come along with this, that is the mental strain. Okay, because you don't have money, you don't have food to eat, because you don't have maybe any proper aspiring goals, or you may end up in a mental strain also, anxiety, depression, okay, inactiveness, dullness. This is also another thing which we have to take care, and this also comes under our health. Here in the NCERT, they have given two columns, where one column they are telling healthcare in India is not that bad. It is one of the greatest in the world. Okay, you would have seen that in the COVID time also, because when Chinese vaccines were failing, US vaccine was expensive. It was India who was saving the world. Okay, we all Indians got it for free also, and India also exported it to 40-50 countries for free. Okay. So India has the largest number of medical colleges in the world. Approximately more than 30,000 new doctors are qualifying every year. There are mistakes in our country. There are problems in healthcare and all. We are seeing that every day in news. But still, the good things also we have to know. Okay, so healthcare facilities have grown substantially. If you see 1950, there was 2,700 government hospital. 1991, there is 11,000 government hospital. And now it is 23,000 in 2017. So you take the latest number also, and this kind of numbers, if you write in your mains answer, you will get 1 extra marks than others, because you have given data. Okay, so note it down. So India gets a large number of medical tourists, okay, from Bangladesh, from other countries and all. They all come here for their eye operation or maybe any other cancer treatment and all. At cheap cost, it is there in India. Okay, so India, when compared with the world, it is one of the best hospitals we have in terms of affordability. Okay, and India is the third largest producer of medicines in the world, and also the largest exporter of medicines also. Okay, so now this is the good things. Now here, if you see, the bad things is also there. Most doctors settle in urban areas. Okay, so people in rural area have to go long distance. They die without having a doctor. They don't get timely treatment or attention. Okay, then about 5 lakh people die every year because of tuberculosis. That is why TB related many schemes our government has told, and by 2030 or 2025, I think you have to try to eliminate it from the country. Like that, many things are there. 2 million cases of malaria is there. Now the new dengue, chikungunya is there. So all these things are problematic things in our country, because one thing is, you should know, India's population is the world's number number one, highest population. So obviously the number of patients, the number of diseases, the number of everything will be high only. So just by seeing big numbers, don't tell like see, European countries have very less cases, we have these many cases. Don't tell that, because their population itself is that much only. Okay, our one city will have that much population, which maybe some countries don't have in Europe. Okay, so that is why don't blindly compare two countries, but the size wise you can compare. So this diarrhea, hepatitis, all these things we have to bring under our, already it is there, universal coverage, and we have to see to it that our children don't die because of malnourishment and many other things. Okay, so we have to see that the government, it's again coming to this chapter about government has to provide all the health services and the facilities so that we can reduce all of these things. Okay, we need the infrastructure. Point number one is infrastructure. This is your answers you have to write. Health center, hospital, laboratories, ambulance services, blood bank, this kind of infrastructure we need. Then we need the human capital, that is health workers, nurses, qualified doctor, professionals. Okay, then third thing we need is the medicine and equipment inside which these people can use in the infrastructure. So these three, like this itself, you have to write in your answer whenever you write about our health improvement sector. Okay, if a question comes. So India has a large number of doctors, clinics and hospitals, and we have a lot of knowledge also. But again, as I told in the starting a practice question I showed you, we are not able to grow upon it. Okay, even though there is phenomenal advancement in medical sciences, new treatment methods are coming, new technologies are coming, even artificial intelligence is being coming into play. Still, India need to again work a lot. Okay, so our country has the money, knowledge, and people with the experience, but cannot make the necessary healthcare available to all. This is the exact statement I took from the textbook and made the practice question for you in the starting. Okay, and NCERT, to make small children understand, they give like comic book kind of picturization is what they are using in the new format of NCERT. So this is nothing that two boys are there, two friends, one is a rich person, one is a poor, one went to private hospital, one went to government hospital. So that differences they are talking, so that small children of class 7th, when they see this, it will be more relatable to them. Okay, so I am not explaining this, you will understand. The private hospital will have excellent facilities and the way they take care of you, and government hospital will have poor facilities and long queues will be there. Doctors may not be available, you have to come again and again. They will tell come after 3 days, come after 10 days. So that kind of comparison they have shown in comic format for children to understand. Okay, so now as I told, two important things, one is public health services and one is private health services. Okay, so public health means what? The government is conducting or running the health centers and hospitals, and it will cover both the rural and urban areas. So it will be for every common illness also, and also for the tertiary special services also it will be there. And if you see in the three levels, village level, district level and city level. Village level, there will be something called primary health center, where there will be one nurse and one health worker mainly, and maybe some supporting staff will be there. Doctors will be supervising all of them. Okay, and they cover one full rural area or one full village or group of villages. District level, there will be one single district hospital, like a headquarter hospital, wherever, even if to like Ladakh, if you go there, also one main district hospital Ladakh will be there. Okay, then large cities have many government hospitals, because there multiple districts multiple doctors are there, multiple people are setting up hospitals there. So the private and public collaboration also will be there. So public alone also lot more will be there in the different cities. Okay, urban area I am telling, not the rural area. So now why are they called public? We keep telling public because the services there, or the doctors there, the facilities there, everything is paid off by the taxpayers' money. We all are paying taxes that only the government uses, and with that only all these facilities are running, or the doctors are getting salary, and the government has to give these services either free or at a low cost, so that even the poor can seek the treatment. That is what is called public services, and they have to take actions on all these things. TB, malaria, jaundice. You know that in whenever dengue is spreading in an area, you will see the government workers coming to spray that chemical around your area, residential area, and also that mosquitoes don't breed. Okay, this is all done by the government. So this kind of things is what we discuss in the public sector domain. Okay, so now there is a question always which people keep asking: why pay taxes to the government? Why should we pay? Okay, because there are some services like defense, police, judicial system, highway. These are all not private things. Okay, little bit privatization will be there, but these are mostly public, and for this, which to benefit all citizens, and why the government will be able to give for free is because you are paying taxes. Okay, so only when you pay taxes, they can fund the education, healthcare, social welfare, vocational training, everything for the needy citizens. And also when disaster come, now if you see in Kerala there is a landslide, in Himachal there is landslide, in northeast there is flooding. Okay, Orissa there is cyclone. There are many things happen. So that time you should know that the government has to give the relief packages. So it's all funded from your taxes only. Okay, everything cannot be like that time. They cannot come and ask for charity or ask for loan. That time they have to have some buffer money, and that is why your taxes are important. Okay. So, because the government's main thing is what? Safeguard the right of life of every person. Okay, right to life is actually under Article 21, okay, under the fundamental rights. So, different campaigns I told you, water coolers, rooftops, mosquito breeding, they have to stop. So, all is government's job. Okay, government has to take care of each and everything. Even the courts, the court have told that it is the duty of the government to provide the necessary health services, including treatment in emergency situations. Okay, so here photographs are shown in a rural area, like a doctor is there, it'll be like a small room, okay, in a small room, clinic kind of thing where they come, they have to stand in queue. After that, the bed also will be this condition. Even a new born baby is like this. And then according to UNICEF, more than 1 million children die every year in India from preventable infections. So this also you have to use in your answer. Okay, every line in NCERT can be used in your mains answer, and that will give you extra marks. Okay, so that's about the public conditions. Now private, if you take in rural and urban, both places we have the private facilities, private clinics. So in rural, they are called the registered medical practitioners, RMP, and in urban areas you have the extra big laboratories which you can do X-ray, ultrasound, scanning, all the testing we can do there. And there are hundreds of pharmacies, okay, where you can buy the medicines also. So that also now government is also there, the Jan Aushadhi Kendra is there. So like that, not owned and controlled by government, there are many things. Those controlled by government is also, there are many things. And in private, the only problem is you have to pay a lot of money for each service. Okay, even for just consultation for any doctor nowadays, minimum I think 500 rupees, 600 rupees they are taking just for consultation. Okay, after that only then your tests, medicines, everything, meaning 1000, 2000 is like a minimum if you get a dengue or something. If dengue test means it's again high. Dengue profile check will be around 2000 rupees for checking dengue alone. Okay, so like that, it's a private thing, means it's very costly. Okay, but it is found everywhere. Medical shops are found across the country, in every corner of the country. Okay, so in India, the private services are increasing, but public spaces are not. This is the main concern. Okay, private, like you see doctors after doctors, clinic after clinic, everything is going on, coming, but public thing is very less. It's not improving. Okay, so everything concentrated in the urban area will not help the people in the rural area, and it's very expensive also, and they end up borrowing money for everything, meaning the out of the pocket expenditure, which we call, okay, out of pocket expenditure will be very high for patients and they cannot afford it. Okay, and also there are some private sectors which encourage incorrect practices to earn money, meaning you simply go, it will be some maybe headache or something, they will tell do a head scan, do a blood test, do a other body test, other some fluid test, something they will do, and they will make you buy a lot of medicines also, and that medicines will be only there in that medical shop which is attached to that doctor, or they have a collaboration. Okay, you will not find that particular medicine anywhere. Okay, so barely 20% of the population can afford all the medicines that require during an illness. Okay, this also is a fact which you can write in your exam. Okay, so now in India we have a body called MCI, or Medical Council of India. Okay, they have a code of medical ethics. That code of medical ethics tells that whenever the doctor prescribes drugs, you should give the generic name. Okay, generic name means instead of telling Panadol or aspirin, Crocin and all, the generic name will be there, meaning it is like some chroma, bromide or some chemical names will be there. So that if you tell, then the person can buy it from any medical shop of like any company they can buy. Else if the doctor forcefully tell like, okay, aspirin this thing or Dolo 650, if you write the company name, then the patient will be forced to buy that, which is costly. Okay, but instead the chemical formulation, if you write the generic name, if you write, then they can buy of a cheaper company also, which will again work the same way only. Okay. So there is a Medical Council of India ethics code which you can quote in your exam, which actually people are not following, doctors are not following, but there is such a rule there. Okay, now one more stat, if you see, 40% of people who are admitted to a hospital for some illness or injury have to borrow money or sell some of their possessions to pay for the expense. That much is their condition. Okay, if they need an ambulance, if you see in some places, this ambulance itself is acting like a clinic. Okay, an open jeep kind of thing. There itself doctor is sitting, there itself patients have to come, or if there's a pregnant lady, they have to walk a lot of kilometers. These are the conditions. Okay, in movies you would have seen all these things. The situations are improving, but still there is a lot to go because of our huge population and huge population density, you can call, in each place. So the number of doctors you need is very like high. Okay, so this borrowing money, anxiety, distress, this tend to happen again and again also, because their conditions are not correct. If conditions were good, at least the malnutrition, the food related thing, drinking water thing, housing, if this is all cleared itself, half of the disease will go. But because they are all undernourished and poor, this tend to repeat again and again. Okay, so now what can be done? The health situation has to be improved. Responsibilities of the government. Health is very much dependent on basic amenities. So they have to work on that only. We have already the Sustainable Development Goal. 17 goals are there and 169 targets are there, which India is doing good actually. We are trying to, you should by heart all the goals, okay. Like it will be like first one will be poverty, second one will be I think hunger, then there will be health, there will be education. Okay, like that you have to make some mnemonic and by heart all the 17 goals, and we are working on everything day by day, and that we have to see that amenities when it improve, automatically the healthcare service also will improve. Okay, so in India there are certain examples, India and outside both I will show you. So Kerala story, if you see 1996, the Kerala government made some major change. Okay, they told that 40% of the state budget will go to the panchayat. Okay, because state, if they give a lot of money, then they can work on all the things. Each village can work on like proper planning of water, food development, education. This is a very successful model. So they improve their water supply, improve their schools, electricity, Anganwadi, everything. Okay, because health is a state subject. Okay, you should know in our constitution we have union list, state list, and concurrent list. Okay, so this is a state subject. So state has to work on it. So state gave a lot of fund to the panchayat level. Okay, so they did a lot of things, but still there are many things to improve also. Okay, insufficient hospital bed, not enough doctors. There are many problems which has to be addressed, but at least 1996 Kerala's 40% allocation is a very good example. You can quote in the exam hall and tell like it should be like a model thing which other states should follow. Same like that in the world. Okay, there is a country, a small country called Costa Rica here. Okay, which is in between North America and South America. It's in North America actually, but it's like near the Panama area. So that if you see, it's in between the Caribbean Sea and the Pacific Ocean, above equator. There is a country. If you let me just zoom it. If you zoom it, if you see, this is Costa Rica. Okay, under Mexico, because many people North America, when they know, they just know USA, Canada and Mexico. Below that there is this Belize, Guatemala, Honduras, El Salvador, Nicaragua, Costa Rica and Panama. Okay, after that only South America will start. Okay, Colombia, Venezuela, Suriname, like that some countries are there. So this you should know. Basic geography mapping also I told you through this because it's not there in your NCERT. I'm just telling you for your information because UPSC will ask it. So Costa Rica is considered to be one of the healthiest country in Central America. Okay, this area is called Central America. Okay, so why it? Because in the constitution itself, in their law itself, they have decided one thing, that we will not keep an army. Okay, every country spends like 2%, 3%, 4% on their defense budget. They decided not to have an army itself. So that much money got saved, and all that money went to health, education and basic needs of the people. Okay, that is why, because they paid a lot of attention, their safe drinking water is there, sanitation is there, nutrition is there, health education is considered very important, everything. So they did everything right, and that is why it's a peaceful country also, and it is having the one of the healthiest people in the world. Okay, so this also in an example you should write in the exam. Okay, so that was the chapter. Some glossary information is there. If you see, what is public, you know, it is controlled by the government. What is private, it is not by the government, it's an individual or a company. Medical tourism is very important. Already mains question have come. You should know which country people comes more to India, whether Indians are going outside for treatment. Communicable disease which can spread from one person to another when you like sneeze or through food, water, air and all. Then OPD, that is the outpatient department, meaning you are not getting admitted there, you are just coming there, getting treated and going away. Okay, that is the outpatient. Other one is inpatient. Okay, then ethics, you know, moral principles that influence a person's behavior. And generic names, I already told you, these are the chemical names of the medicine. Example C, acetyl salicylic acid is the generic name of aspirin. Okay, so instead of telling forcefully by aspirin, you can write this in the prescription. So any companies they can buy. Okay, that is called generic name, and that is what Medical Council of India has told to do. Okay, so now 2025-26 aspirants, please WhatsApp me and tell me whether you have joined the test series, or if it's joined, it's okay, I know already. If you want to join, okay, tell me, I will launch the new batch soon. And also if you're not joining also, please come and ask for the free foundation and start studying today. Okay, there's no tomorrow. You are already wasting a lot of time, and if I have to do lectures every day, I need serious aspirants. Okay, we don't want people who are time passing and all. We need serious aspirants. So try to contact us and learn. Okay, because now the next chapter also, how the state government work, where MLA related things and all I will tell you, will come soon, only based on your response. Okay, so please comment and tell us, okay, what you need next. So I'll wind up this. Thank you and have a nice day.